Well, thank you, Mr. Chair and Ranking Member Murray. Thank you, Governors Hogan and Brown, for being here. Thank you, Governor Brown and Senator Isaacson, too, for being brave to speak about your personal stories as they connect to this epidemic. Other Americans have been speaking up, being brave, sharing their stories, too. So I just would like unanimous consent to enter some narrative and some photos from this week's Time magazine called The Opioid Diaries. It is compelling, and I think the pictures in particular capture what is happening in our country because of this epidemic. So with unanimous consent, I'd like to enter some of those photos and narrative into the record. I want to return to the issue of medication-assisted treatment in a minute, but I want to touch on something that we haven't talked about that much yet. I believe that strategies to address the opioid epidemic need to be thoughtful, they need to be long-sighted and multifaceted, because while we talk about this as a crisis, we now have a generation's worth of work to do before we begin to truly turn ourselves around from the impact of this health epidemic. It isn't something we can fix overnight, so while the $6 billion we secured in the bipartisan budget agreement is a start, we know that we ultimately need far more funding beyond this to truly address this crisis. I'm going to keep fighting to make that happen. I know a lot of people here are doing that as well. The National Governors Association recommendations for federal action to end the nation's opioid crisis recognizes the need to increase federal investments. And during my time as governor of New Hampshire, I worked with Governor Baker to develop the first NGA recommendations on the epidemic, which similarly noted the need for additional resources. The bipartisan consensus among governors on the need for increased resources highlights just how serious this epidemic is. I've made this point in our other opioid hearings, and I'll make it again. We have to make sure we're making robust, sustained investments to stop this epidemic, investments to support those on the front lines of this crisis, and investments in prevention, treatment, and recovery. To that end, governors, what would additional funding mean for your efforts on the ground? And Governor Brown, why don't I start with you?
Thank you, Senator Hassan. In terms of additional resources, I think they would be key for making sure that we have affordable, generic overdose drugs available to all of our first responders. That is huge. It is an issue for us. And having additional resources would be key. Making sure that we have access to comprehensive behavioral health treatment and effective substance and alcohol abuse treatments. That's how our dollars would be focused.
Okay, thank you. Governor Hogan?
Senator Hassan, I agree with you that we need more federal funding, and not to say that $6 billion is not a lot of money. It is to the taxpayers, but it's a drop in the bucket compared to what we actually need. And I mentioned earlier, our small little state of Maryland, we've already spent $500 million in state funds.
Yeah.
And $6 billion stretched across the country is not going to go very far. But we need it from different places, right. And for different reasons. And a medically assisted treatment we talked about, long term. You mentioned it's not just the immediate crisis, but it's the long term recovery support services that we're going to need a way to pay for.
Such as housing, for example.
Mm-hmm. Exactly.
Right?
So it might be additional funding in multiple different departments' budgets. This is not just a health issue,
yeah.
Or just an education issue, or just a crime prevention issue. It's across almost everything you're funding.
Okay. Well, I appreciate that. And the cost to New Hampshire in 2014 economically was $2 billion. The cost to our country in 2015 was $504 billion from this epidemic. That's the economic impact of this crisis. So I agree, $6 billion, while it's a lot of money, isn't going to do the trick. Just quickly on the medication-assisted treatment, and if I'm around for a second round of questions, I'll go into it more, but SAMHSA does have a buprenorphine practitioner locator on its website by state and by zip code even, so that may be of assistance. And I have a bill, and I'll provide it to you, that would provide grants to medical schools to develop curricula around medication-assisted treatment, standardize that curricula so that as people are learning about prescribing opioids, they can also learn about addiction and treating addiction. And if we can standardize those curricula or agree on some basic credentials for it, that would allow them to automatically get the kind of waiver that they need to become practitioners in this field wherever they decide to go practice. And I am hopeful that that will help us with the volume of practitioners, because in New Hampshire it's a great need, and I'm hearing from you guys it is too.
Yeah, I would agree with that completely, Senator.
Okay.
Absolutely, thank you.
Thank you both. Well, thank you, and thank you for having the second round of questions, Mr. Chair and Ranking Member Murray. And thank you both for your persistence and stamina. Look, I think one of the things that's really important as we talk about all the challenges that this epidemic brings is for us also to focus on the fact that recovery is possible. In my state, I have been just honored to know people who have suffered from this disorder and gotten better and turned their lives around, and then are in the field working for people every day. I am reminded of a grandmother, I didn't know it at the time, it was the annual egg roll hunt at the State House the day before Easter a few years ago, when a woman came up to me with a baby in her arms, and I admired the baby. We took our picture. You both know how this works. And she then pulled me aside, the woman, and she said, you know, I'm not this child's mother, I'm his grandmother. His mother died of an overdose a month ago. That grandmother was there with her grandbaby to ask me for help on the weekend that we celebrate renewal and resilience as Christians. And I keep her in mind all the time, because in fact, this is an illness that can be treated and people can have productive lives afterwards. And so we have talked a little bit about the importance of medication-assisted treatment here. We have talked about the barriers of insurance, and one of the things I'd like you both to address is whether there is action we can take from here that, you know, generally we regulate insurance at both the state and the federal level. Should we be looking at federal regulations to make sure that insurance coverage gets that best treatment to the person first? And how can we increase our capacity for treatment and recovery services? So why don't I start with those kind of two general themes?
Sure. Go ahead.
Whichever one of you wants to start.
Well, thank you, Senator Hassan. I think one of the key pieces is making sure that our substance and alcohol abuse treatment programs are effective and that folks have access to the best treatment first and the most effective assistance immediately. And I would welcome, normally as a governor, I don't always welcome federal engagement in this issue, but to the extent of federal conversation about what comprehensive behavioral health looks like and making sure that we understand that everyone needs to have access to it, I think are absolutely key. And we know that we are seeing challenges in our kindergartens and early pre-K with children that are really struggling, and we need to be able to make sure that they have access to therapy, the support, and the wraparound services they need so they can be successful, and we don't end up 20 years from now having to address substance and alcohol abuse treatment issues.
Thank you. Governor?
Senator, thank you for sharing that story. I think every one of us has been either touched by it personally, or we've had those same kinds of conversations with people that moved us. I mean, I didn't mention it earlier and don't talk about it much, but I had a first cousin who went through 3 years of treatment and became clean and got married and had a kid and was happy and turned his life around and had a good job, and then one time went out and died of a heroin overdose. And so while it's great to see the people who have gone through treatment and been successful, and many of them are the best folks to talk to other people and work in some of these treatment and counseling centers. But they're the sad cases. Unfortunately, the majority of people, the treatment doesn't work.
Well, or it does. So let me interrupt there and then move on to one other quick issue. I think the treatment over time can work, but this is a chronic illness.
Yes.
So when a diabetic happens to have an insulin level go wrong, we don't say, oh, gee, no treatment will ever work for that person again. We understand it as a chronic disease that it is, and I think we are just learning about how to treat this disease, especially with the onslaught of these incredibly powerful opioids like fentanyl, which just has raised this to a different level. I will ask for the record, because my time is almost up. One of the things we're doing in New Hampshire with federal funds is bringing mental health and substance use professionals into our school systems to deal with the trauma that kids are facing who are coming from situations where addiction has really turned their lives upside down and created trauma. And I would love to know whether you have similar programs in your state, and how, and if and how federal funds could help you do more of that. Thank you.
Thank you.